Hi everyone, and thanks for watching today's video. Today I'm going to talk about skin rashes in COVID-19. When COVID-19 first came to United Kingdom, a helpline was set up by the government called NHS 111, people who don't live in this country, just to tell them how it worked over here. And if you had any symptoms of especially cough or fever, then you were supposed to ring NHS 111 and they will give you advice whether to stay at home or go to work, etc. However, since I developed COVID 19 myself, I realized that cough and fever are not the only symptoms, and perhaps not the first few symptoms that happen with COVID 19. So, as some of you know, I did develop COVID 19 infection about 5, 6 weeks ago. And I'll go through my own symptom that happened and in the order they happened. So, first symptom that I had was cough, which was a throaty cough, and it happened a week before my main symptoms started. I had no fever at the time. I checked my fever almost every day because of the concern of COVID 19 and not taking it to work. But I did not have a fever for another day, so another week. So I carried on working. And at the same time as cough, I lost my taste. I had this terrible metallic taste in my mouth all the time. So that was my second symptom. Third symptom I had about a week after the cough started was fever. This was about day 7, day 8. And at the same time, I was getting severely tired and my had no energy. I just did not want to get up or anything, and unusually tired. Within a day of that happening, then I started getting very breathless. And breathlessness was quite severe that after the first day of breathlessness starting, just walking maybe 3 or 5 meters was becoming very, very difficult. And I was totally out of breath, and I had to take deep breaths to catch my breath in, and my chest used to hurt when I used to take a deep breath in. It's as if feel like you're breathing through a straw that's struggling to get air in. I also at the same time had diarrhea. This was not very bad, but obviously, some many people don't get all these symptoms, but strangely enough, I got all of these symptoms. Now, all these symptoms stopped about 4 weeks ago, but my cough persisted for another 2 weeks until a week ago. And a week ago, cough went, and I was absolutely fine. Then my skin rash started. At first, I didn't think much of it, but when I did a Google search on it, that what sort of skin rashes people get with COVID 19, if they get any rashes with COVID 19, I found a few papers from and people's comments from Italy that 1 in 5 people do get a skin rash. So I'm just going to talk about my own skin rash and how it felt and what it looked like. So, how did my rash start? My rash first started on my scalp. So, I had these little pimples on my head, which are very, very itchy. And at the same time, above my eyebrows, both eyebrows, I had these little spots or pimples, what became very, very itchy. And my back was covered with these little pimples with heads on them. Looks like they had a little pus in it or whatever, but there were quite a few. At first I thought I just had an allergic reaction to something. To my knowledge, I'm not allergic to anything, but anyway, I took some antihistamine thinking that might have been allergic reaction. Nothing changed, to be honest, but I started getting some more spots a few days later on my legs and on my arms. But what was happening that all these spots were at a different stage. So some of them were appearing as red patches, and I'll show you in a second the picture. Red rough patches. And after a couple of days, those red patches, rough patches like eczema patches, they will develop a head like a blister, or sometimes even pus in it, usually just fluid in it. And then new ones will develop while these were maturing. So somewhere else on the body I will have, or the same part of the body I will have another red patch starting, one or two red patches starting, and then they will become into blisters, while the blisters that I had a day or two before will burst and will leave me with a raw area. And when it was like a raised red patch, and when it was blistering, it was very, very itchy. But once the blister has burst and the fluid had come out, it'll weep for a day or two, and then after that, all the itchiness will settle down. So now I'll show you a few photographs of these, that how they started and then how they evolved into different parts. This started about a week, 8 days ago, and I still have them on me, and new ones are still developing. So I'll show you 2, 3 photos of what it looks like. So this was the first stage of the rash. As you can see, there is one little red patch at the bottom of the screen and one just slightly above it. This is my left forearm, and this is how they usually start. This is yet another part of my body in which there are rashes in different stages, some red patches, some little pustules over there, and some blisters which have already burst. So this is my left leg, and you can see a little head in the middle of the patch, and as it gets worse, that blister will become bigger and will eventually burst. In this one you can see that the blister has burst now, and it has left me with a raw area. At this stage it's quite painless, it doesn't itch either, and it's quite comfortable. Before getting to this stage, it was quite itchy and was very, very weepy. This is finally my back, where the rash started earlier on, and all these blisters are all settling down. They're all crusted and like little scabs on them. At this stage they are painless and don't hurt very much, and neither are itchy. So let's talk a little bit more about these rashes. So as most of us know that rashes with viral diseases are quite common. That's why when children get their viral sore throat or cold, they come up with a rash on their face and on their body. So they are very, very common. But in COVID-19, the type of rash most people have been described to get are small red little pins, blood spots. That's one variety. The second variety, they get blisters, chilblains, or hives, like you have had an insect bite or something, and that's very common as well. And some people get chickenpox like rash, which I think mine was more chickenpox like rash. It was a bit bigger, some of the spots, as compared to normal chickenpox, but perhaps between these two is where my rash fits. They can develop anywhere in the body, and that is the important thing to remember. However, recently dermatologists with COVID-19 has noticed rash coming more frequently on fingers and toes, and I think they call it COVID-19 fingers and toes. So these are the common places where they can happen. Important thing to remember is, as we know, rashes are very, very common, and rashes can happen to anyone, like allergic reaction or hay fever, with hay fever, etc., or some other allergy or insect bites, etc. However, if the rash that develops on you, which is very, very unusual for you, and even if you don't have any symptoms of COVID-19, then you should try and contact your doctor to get further advice, because that rash can be, not necessarily, but can be because of COVID-19. And the doctor might ask you to isolate until other symptoms develop or until the rash settles down. And when is the commonest time for the rash to develop? And quite a few people are noticing that a bad rash starts at the beginning of the disease. So sometime even when the cough and fever is not there, which are the first few symptoms, the rash can develop quite early on. So it's important to remember with COVID-19 that the symptom that we initially thought were the initial symptom, like cough and fever, are not always necessarily the beginning symptoms. The second time, which is most prevalent in these patients, is when the disease is extremely bad. So when they're in the hospital, which is week 2 to week 3, going on to week 4, that is the time when they can develop a rash. In my case, the rash was quite delayed, so it happened almost a month after my main symptoms have settled down and severity of the disease was gone, and that's when it developed. I developed my rash. So 3 or 4 weeks after my extreme symptoms had ended. So, what is the treatment for the rash? In most patients, there is no need for any treatment. Like any viral rash, it will settle down with time. Take a few days, maybe a week or two, but it will settle down with time. Like children's rashes settle down. If, however, it's very, very severe and it's very unusual, and then you should seek medical advice from your doctor. In my case, I did use 1% hydrocortisone cream, which is a very low dose steroid, and you can get it over the counter from any pharmacy. You don't need a prescription for it, certainly not in the United Kingdom, and I'm sure it's the same in other parts of the world. And I used it only when the skin was rough and it was quite itchy. I did not use it when it's blistering or you got pus coming out of it. That time is probably not a wise thing to use. At any stage, you can use calamine lotion, which is the lotion we use on kids for sunburn and burns on the skin and irritated skin, rashes on the skin, etc. And zinc oxide is available everywhere over the counter, very soothing. Apply it on the skin, especially before going to bed or when you are up and about in the morning. I hope you found this video useful. Please stay safe and I'll see you in a few days. Thanks for watching.